Hello, thank you for joining me. My name is Anil Taylor. I'm a consultant gynecologist and I practice in the UK. So in this video, I'm talking about what happens to somebody who is diagnosed with a cervical cancer. And this is actually second of a three-part video. So please go and search out the first part where I discuss the initial priorities that we as clinicians look at when somebody is diagnosed with a cervical cancer. So in this second part, what I want to concentrate on is how we decide how much cancer there is, meaning how we stage the cancer, because staging, as I mentioned in my first video, it helps us then decide what the most appropriate treatment is going to be. The third part that I will be producing will be concentrating on how we use that information, the staging information, to then decide what treatment is best for the patient. So now, in the previous video, I talked about how cervical cancer staging takes place. But what I did not discuss in that video is the importance of the lymph glands. So cervical cancer, if it is going to spread, one of the places that it can spread to are the lymph glands. So the pelvic lymph glands are in this area, and the para-aortic lymph glands are in that area. So these are the lymph glands that cervical cancer can spread to. So we have to take that into account when we do the staging. We have to decide whether those lymph glands are likely to be involved or not. Because if they're involved, then if you think about it, just doing a hysterectomy to remove the womb and the cervix is not necessarily going to address the cancer that is residing in the lymph glands. So we need to take that into consideration. So one of the ways in which we find out how much cancer there is, meaning whether the cancer in the cervix is spilling out into its sides, or whether it has traveled to the lymph glands, is to do an MRI scan. So in the MRI scan, so here you can see three images. The first image, the orientation, the front of the patient is in the direction shown, and the womb is, the body of the womb is there, and the cervix is in that area. And in the second picture that you can see, there is a lump there, and that is a lump in the cervix, which represents the tumor. Now, if you look at the third picture, which is a cross-section through the cervix and other tissues in the pelvis, so the cervix is in this area, and what you can see is tumor spreading out, spilling out of the cervix and going into the left side, or the left side ligaments supporting the cervix. So it is telling us that the tumor is spilling out of the cervix, so which means that in the staging system that I explained, it is at least a stage 2B. In the system. So why is that important? The reason it is important is because if we were to do a hysterectomy, which is essentially where we would be taking out the womb and the cervix, taking out the ligaments that support the cervix can be done, but it is a very, very big operation, and sometimes we would choose not to do it that way because there are other ways of addressing that kind of disease, which I will cover in the third video. So essentially, that tells you how MRIs are used to give us this information about cervical cancers, especially whether they are spilling out of the cervix or not. So the other scan that we do is the PET-CT scan. Now, not all hospitals do this, but certainly in our area, in our hospital, we do a PET CT scan. So what information does a PET CT scan give us? So again, there are two pictures here. In the first picture, the orientation, the front of the patient is in the positions shown. The second picture is looking at the patient face to face. So in the first picture, the womb and the cervix are roughly in that position. The vagina is in that position. And in the second picture, the womb and the cervix are roughly in that position. So what you see from here is that there are some areas that are lighting up in shades of, well, the most intense one is where the red is. So what you can see is here, that is a tumor within the cervix lighting up. Now, what is important to realize is that there are other normal tissues that also light up. And so here you can see in front of the cervix is another area, but that actually is normal. That is just urine in the bladder that is picking up the dye and lighting up. And similarly, so these are the kidneys here, and you can see some activity within that. Again, that is normal. But what is not normal is these sort of areas. So what they represent are the lymph glands, the pelvic lymph glands that are clearly lighting up. And these are lymph glands higher up. These are in the para-aortic chain, and they are lighting up. So what that tells us is that the cervical cancer in this patient has spread to the lymph glands. And so this information is important when we decide the treatment that this patient will receive. So the other thing that we sometimes also do to find out how much cancer there is what we call an examination under anesthetic, meaning a patient is brought in as a day case and given a short general anesthetic and then have an examination. Now, why does this examination have to be done under anesthetic? Well, because it is a fairly detailed examination where we will really be pushing the tissues and poking, and so it can be, of course, very painful if it didn't involve an anesthetic. So we would do a vaginal examination to find out whether the cervical cancer is spilling out onto the vaginal skin. We will assess the mobility of the cervix, because in a normal individual, the cervix will move from side to side, front to back. But if, for instance, if the ligaments of the cervix are involved, then that mobility will be restricted, and we can get an impression that perhaps the cervix is spilling out. We will do an examination of the back passage, a rectal examination, again to find out, to get an information about the cervix in front of the rectum, whether it is moving normally or has a restricted mobility. So we will do an examination of back passage. In addition to just these digital examinations, we will also often carry out a cystoscopy, meaning put a telescope into the bladder to find out whether the cancer in the cervix is invading into the bladder. Because if you remember from the staging system, if the cancer is invading the bladder, it becomes a stage 4 cancer. Similarly, we will put a telescope into the back passage. That's called a sigmoidoscopy. And we will put a telescope into the back passage to see whether there is any cancer spilling out or invading into the back passage. So this is all done in one examination. It takes about 20 to 30 minutes to do. And it gives us information about how much cancer there is, especially in the localized environment of the cervix. What it does not tell us is whether the cancer has spread to the lymph glands. So that's where, of course, the MRI and the PET CT scans are important. So that is an examination under anesthetic, and that is what we will often do to assess the patient. unless it is obvious from all the scans that the cancer has spread, and in which case we will use that information just to decide what the best treatment will be, which I'll be discussing in the third video. So that is all I want to say here. Please remember that this is a second video in the series. In the first video, I discussed our initial priorities when somebody comes with a cervical cancer. And in the next video, I'm going to be discussing what we do with all the information that we have gathered from the scans and the examination, and how we will use that information to then decide what the best treatment is for that patient. So please go and search those videos out as well. And in addition, I have many other videos on other similar topics where I discuss things like cervical pre-cancer, colposcopy, HPV, lots of other things that I have uploaded. So please go and search them out. And if you like these videos, then please consider subscribing or at least clicking the like button. Thank you very much for watching this video, and until next time, please stay safe.